It is becoming easier to find a family doctor or a nurse practitioner in Calgary. New data shows that the number of physicians taking new patients has gone up significantly. There are now 251 doctors and nurses taking new patients, up from 47 this time last year. Dr. Christine Luelo is the Calgary Zone Medical Director and a family physician with a clinic in South Calgary, and she joins us now in studio. Good morning, Doc.
Hi, Lauren. It's wonderful to be here to give such good news.
Yeah, I appreciate you doing this. And it does seem like good news, like 47 to 251 in the run of a year. How did this change happen?
Yeah, we think there's probably a few factors that are at play here. I mean, number one, Alberta's a wonderful place to live. It's beautiful. We've got great weather most of the time. But we also have seen a couple of changes over the last year from a financial perspective that are probably incentivizing that change. Nurse practitioner program that, of course, was in the news last year. So now nurse practitioners can panel patients the same way family doctors do and provide care. But more importantly, to me as a family physician, is the new primary care compensation model that went live on April 1st of this year, so just a little over a month into that. And it really is designed to incentivize longitudinal comprehensive care. So that's like from the time you're born right up until the end of your life, that we're able to care for you and compensate it differently and better in order to do that properly.
Do you know what the breakdown of that 47 to 251 is? Is that... how much of that is nurse practitioners? How much of that is family doctors?
Yeah, the website has historically been only physicians. We've added nurse practitioners in the last year. So the 251 is mostly family physicians with a small handful of nurse practitioners. But of course, they only started setting up their own practices last year. So we've got to give them some time to get their feet under them.
I want to be it can be a mouthful, but I also want to be really clear about the language. So family physicians and nurse practitioners. How is that, what role are nurse practitioners playing in easing the pressure on the system, and how is that integration of service providing going?
That's an excellent question, and I think it's one that we're still trying to unpack because the consultation with the College of Nurse Practitioners was separate from that with the family physicians. So what we're going to need to do moving forward is really think about, if nurse practitioners have an 80% scope of practice, what does that extra 20% look like? How do we have to, as a system, really set up some supports around the nurse practitioners? How do we collaborate between family practitioner clinics and nurse practitioner clinics so that patients get all the care they need without having to go into the tertiary or secondary system? So we don't quite know the answer yet, but I think we're starting to see that as nurse practitioners set up, it again, as I said earlier, gives patients choice for the type of practitioner they might want to see. And again, really so important that you feel comfortable with your primary care provider and that you can feel vulnerable there and tell them everything, really. I mean, I have patients that tell me more than they tell their spouse about their lives. So that's a pretty honored position to be in.
Yeah, no kidding. Okay, well, thanks for the work you do. Thanks for popping in this morning and laying this out, what we know and the questions we still have. Appreciate it.
Yeah, thanks so much, Lauren.